Hi, this is Paul Slack. It's Good News Planet. We're going to talk about health and wellness. Preventive health care programs help you take control of your health from the comfort of your own home. Okay, that's good news. We have Dr. Jeffrey dlott. Hi, Dr. dlott. How are you?
I'm great, Paul. How are you?
Okay, good. I hope I'm pronouncing your name right. You're the medical director, consumer
Perfect.
health. Was it? Okay, good. Consumer
Yep.
health, Quest Diagnostics. I will also say, I mean, I got this interview sort of randomly in the sense, but Quest has been my go-to diagnostic center here. I'm on the Upper West Side of Manhattan, and my Dr. Minatoli, who I've been with for 20 plus years, and actually his office was right next to the Quest at one point, but he's always said to go there, and I've been extremely satisfied. And I'm just going to say that up front because there's nothing better to feel more comfortable when you go and take these blood tests and you go and you take other kinds of tests to feel comfortable that the information you can receive at the end of the test is going to be correct. Now you have something new.
Wow.
I don't have to actually walk up to 86th Street or down to 59th Street. You have something at home. What's going on?
Yeah. So thank you for that really kind and introduction there. And we're so glad that you are happy with our services. We have a new virtual preventative screening program that is now available in 48 states. Uh, excuse me. Um, That is a virtual preventative screening offered through questdirect, which is our consumer-initiated testing service through Quest Diagnostics. This service includes over 100 health data points that include biometrics, health risk assessments, and laboratory data to give you a snapshot of what's going on in your body. In addition to this program, you have the opportunity to discuss your results one-on-one with a clinician at no additional charge, or we make it easy for you to share your results with your physician.
Uh-huh. So is this grown out of the COVID times where maybe somebody might feel concerned about going anywhere?
Yeah, you have it exactly right. That during the pandemic, people have been postponing their annual checks, and annual wellness checks are very important. They give you an insight as to what's occurring inside your body so that you can take action to prevent illness and disease before it becomes significant. So the pandemic, and you're absolutely right, has totally changed the way we're thinking about virtual healthcare
So
in
how do
its
I went
role.
to your website also. The website
Yeah,
is questhealthscore.com, right?
correct.
All right,
Thank
I
you.
went there. So how does this actually work? Is this a Zoom world now?
Well, kind of. So let me walk you through the process. The easiest thing to do is to download, if you haven't already, the MyQuest app.
Right.
It's through the app that you can purchase the comprehensive health profile. And the app will then prompt you to respond to the questionnaire that we call the health risk assessment. And then this is a little bit different than what you were describing, Paul, but you need to schedule an appointment at one of the patient service centers, and there's over 2,200 in the United States, so it's very convenient to do that. And it's at the patient service center that you will get your blood pressure and weight and other biometrics that you would ordinarily get at your physician's office, and you'd have your blood drawn for your laboratory data. 2 to 3 days later, you should receive an email telling you that your results are ready, and you go to the secure portal and you can review your results, read the interpretation. It's understandable for the average person. But if that's not enough, again, you can schedule that telehealth visit with one of our clinicians, or we make it easy again for you to forward to your clinician.
Uh-huh. So I'll be frank, I don't do anything without talking to my doctor. And
Yeah.
almost to be frank, I wouldn't, if I take a test, I tell him I'm going to consider, I'm not a doctor. I don't know. And so Is it very important to have this relationship, in essence, to continue that relationship?
So it's wonderful that you have that relationship with your
Not
doctor,
everybody
and I
has it.
wish everybody had. Yeah, not everybody has that. And so this is a service that has been adapted for those who either have concerns going to a doctor, don't have a doctor, have other types of access issues. This is a reimagined annual physical. So the way we like to think about it is it's reverse engineered. You contribute your history, your biometrics, your laboratory data. You think about, you read your report, your data, and then whether it's through our telemedicine clinician or your own, you can have a more meaningful and substantive conversation.
And you'll also then have, I've always wondered how come, we don't have these documents easily accessible on this thing called the phone or the computer.
Yes.
You will still have those in archives, right? So they could be, I mean, that's very important, isn't it?
Yes. It is. And the app that I've been describing for you is that repository, it's that portal that shows your data. In fact, one of the things that are it's a virtual report, so it will show your history. So for example, included in our report is a cholesterol level. If you have had previous cholesterols performed at Quest Diagnostics, you'll be able to see on this virtual report how you've been trending, which gives you yet more useful insights.
Oh, majorly. I mean, that's what a lot of my doctor does do. He checks to see, well, you were at, and you were at. And
Mhm.
well, I got a long history of Quest Diagnostics because I also want to say here, and you, I'm sure, will agree with me. I think you're quite irresponsible, actually, I'll use that word, if you don't get checked every year. Wouldn't you agree to that?
Okay. Um, well, we definitely, I don't know if I would go as far as to call people irresponsible. I might make some enemies that way.
Oh,
But
you can, I'll say it. You
we
don't have
do, yeah, but we do think it is a good, healthy practice to get annual screening and to be proactive about your health. So we'll settle on that. How's that?
that's fine. And then when you do that, I'll just add one other thing. I mean, this you have a layman here who's always interested in his health, but find out a lot of information. Don't just find out the cholesterol. Find out many things. Because one thing about that blood, it's like a miracle to have it, thank God. But then two, you can learn a lot
Absolutely.
about your life, right, with the blood tests.
Absolutely. You know, what I didn't have opportunity to say is that this comprehensive health profile gives you insights into glucose control, like prediabetes or diabetes, or whether or not you're anemic that would potentially need to be worked up, or insights into cardiovascular heart disease risk factors. So it is comprehensive, but we also have an optional tests that people may select as well that are gender specific. So it would include a PSA for prostate health for men and a TSH for thyroid health for women. Our whole menu is available on questhealthscore.com, where we have over 50 different tests for one to consider purchasing.
Fantastic. Doctor, thank you so much for sharing this important opportunity for people. I know I have a very unusual situation where I can call my doctor at any time, but most people don't. So to have this available sounds great. Thank you very much.
Thank you, Paul. Thanks for having me.
Okay, take care.
Bye-bye.
Bye bye.